Hello beautiful people, welcome to my YouTube channel, welcome to Nurse Yubi's desk. In my platform, in this channel, I give information concerning health but with greater emphasis about cancer. Okay, so in this topic of today, in this very video, I'm going to be discussing the predisposing factors or the risk causes for cervical cancer. Okay, since it is cervical cancer week, I don't have an option but to tell us, to educate us, or to sensitize us on the different things relating to cervical cancer. Okay, so like I used to say, if you're new to this channel, you're very welcome, because you're going to be seeing videos from me on factors of so many things, topics relating to cancer. I'm going to be posting new, very informative videos and educative videos concerning the things we need to know about cancer. Okay, and if you're not new to this channel, you're very welcome, and thank you very much for always watching my videos. Each time I post very new helpful videos in my platform. So today, like I said, we'll be discussing on the predisposing causes for cancer. So I'm gonna start by telling us that I've already posted videos concerning the cervix and the functions or the roles of the cervix to a woman, to the reproductive life of a woman. So now we would be worried about what could have been leading to the cervix developing this big name, cancer. Yes, fine. There are different risk factors. There are so many things that could predispose the cervix to cancer, but I'm going to point out the very, very important ones. Sometimes we may be used to them, but we haven't really had a broad idea about them. So I'm going to further enlighten us today on this causes of risk factors for cervical cancer. The number one risk factor for cervical cancer is the human papillomavirus. The human papillomavirus is a virus that lodges in the cervix, and then it causes mutational change to the cells of the cervix, which predisposes a woman to having cervical cancer. And how do you contact this human papillomavirus or human papillomavirus infection? You contact this infection maybe by having unprotected sexual intercourse with an infected partner. Okay, so this is how you contact human papillomavirus. So we go to number two. The number two predisposing factor for cervical cancer is having many sexual partners. Okay, and possibly you're not protected, you're having intercourse with them unprotected. So we usually tell people to know your partner, or better still, you protect yourself so that you would be better protected of developing this infection. Number three is smoking. Okay, so in smoking, like I used to say, smoking, the carbon that is coming out from smoke, these are things that we call it, we name it as oncogens, or you can call carcinogens. They are chemicals. These are chemicals that are capable of causing mutational changes in the cells of the body. Okay, so we go to number four risk factor for cervical cancer is when you're talking about the birth control pills, the oral contraceptives. These oral contraceptives are hormonal drugs, okay? They are made with hormones. So, and hormones are the things that help in growth and proliferation of the cells of the body. So when you take them in excess, and a particular hormone, for example, you have the estrogen that helps in the proliferation of the cells of the body, or of the human reproductive part of the body. So this is the major hormonal factor, or when you're talking about birth control pills, that predisposes a woman to cervical cancer. Then we go to number five, and the last important factor in this particular topic is when you're talking about having being predisposed to having early sexual intercourse. You're exposed to sexual life at a very tender age. Okay, so when you've not even grown, but like now in this world of today, you see young girls of today, they haven't even approached maybe age of 18 years, you see a woman or a lady or a girl starting being exposed to sexual life at the tender age of 8 years, 10 years. These are the factors that contribute to predisposing a girl or a lady to cervical cancer. There are so many other factors, but these are the most important ones. I'll still discuss them as we go further in my channel. I'll still keep on bringing videos up to tell us more and more things, more common things that can predispose a woman to cervical cancer. But how do we prevent these things? I'm going to go straight to the point. In human papillomavirus, like I say, is for us to know our partner, or we make sure we have protected sexual intercourse each time we want to do it. And then you practice safe sex. Like I say, you go to cervical screening. In cervical screening, what we do here is that we take a pap smear. We call it a pap smear, a smear from the upper part of the vag. You go up into the cervix, and then you scrape the cells of the cervix, take it to the to a lab for histology test. Like I tell everybody, that there is no diagnosis of cancer without histology, without histological report. So this is the test that is done to confirm that one has cervical cancer. And when you carry out this pap smear and they find out that you are free from human papillomavirus, there is always a way out. That's when we're talking about vaccination. I urge all women today to walk into a facility, get screened, know your status, and then get the vaccine. The commonest vaccine that we have for human papillomavirus, prevention of human papillomavirus, is the Cervarix vaccine. We give this vaccine to women that have started, that are exposed to sexual life. And these women, you find out, you start from the age of 18 years. Before, it used to be 25, but we give from the ages of 16, 18 years down to the whatever age you can call it, okay, to 29, 28 years. This is the age that is stated out for women to receive this vaccine, okay? And then the other factors of how to prevent yourself from having cervical cancer is when you're talking about you elicit smoking and alcohol. You rule out obesity, okay? Lose some fat, lost some weight, and this is going to help you. And then also delay your first exposure to sexual life, okay, to sexual intercourse. When you do these things, I bet you're going to be at a very slimmer chance of developing cervical cancer, okay? Thank you very much for watching my video, and I'm very grateful. Also, still on this platform, you can also always visit my channel. Each time you can share my videos to your friends, your neighbors, people around you, because these videos are very educative and helpful. Okay, this is to do some awareness to people who haven't had this or have had this, but they haven't taken a step to these things that I talk about. Okay, if you're new to my channel and you haven't subscribed to my channel, please do click on the red subscribe button below this video, and also turn on the notification bell right beside the subscribe button so that you'll be getting notifications each time I post new and helpful videos in my channel. See you next time. In my next topic, I'll be discussing the signs and symptoms of cervical cancer. Thank you very much for staying tuned in my channel. Shout out from Nurse Yubi. Bye.